Question 1. A 45-year-old woman presents with progressive muscle weakness over several months. She reports difficulty climbing stairs and combing her hair. Physical exam shows proximal muscle weakness in the upper and lower extremities, but no skin changes. Laboratory studies reveal elevated creatine kinase, CK, and aldolase. Electromyography shows myopathic changes. A muscle biopsy shows endomysial inflammation with CD8 plus T-cell infiltrates. Which of the following antibodies is most likely to be present? A. Anti-Jo1, B. Anti-DESC, anti-centromere, D. Anti-Smith, E-antitopoisomerase CL70. Correct answer, A. Anti-Jo1 is the most common antisynthetase antibody and is associated with polymyositis. It is also associated with interstitial lung disease, arthritis, and fever. Why not the others? B. Anti-dsDNA, specific for SLE, especially lupus nephritis. C. Anti-centromere, associated with limited scleroderma crest. D. Anti-Smith, also specific for CILI, but not linked to polymyositis. E. Anti-HECL70, associated with diffuse scleroderma, not myositis. Question 2. A 39-year-old woman presents with weakness in her thighs and shoulders for 2 months. She also has a rash on her upper eyelids and knuckles. Physical examination reveals a heliotrope rash and Gottron's papules. Her CK level is elevated, and muscle biopsy shows perifascicular inflammation. Which of the following antibodies is most closely associated with this patient's diagnosis? A. Anti-MyDo, B. Anti-Jo1, C. Anti-Ro-SSA, D. Anti-SRP. E. Antihistone, A. Anti-My2. Anti-My2 is associated with dermatomyositis, particularly the classic skin findings, such as heliotrope rash and Gottron's papules. It is linked with a better prognosis. B. Why not the others? B. Can be seen in both polymyositis and dermatomyositis, but is more associated with antisynthetase syndrome and interstitial lung disease. C. Anti-Ro-SSA, seen in Sjogren's syndrome, and SLE, not specific for dermatomyositis. D. Anti-SRP, seen in polymyositis, especially a rapidly progressive severe form with poor response to therapy. E. Antihistone, associated with drug-induced lupus, not inflammatory myopathies. Would you like